Hey guys, today we're going to talk about where do hair transplant surgeons go for hair transplants and what kind of secrets are they using to get the best results. So Dr. McGrath recently had a hair transplant, and it's funny because I've gotten comments on a lot of past videos where they'll say, hey, well, what about that hair transplant surgeon? You know, it must not really work because he's balding. So if he really believed in his work, then he would get a hair transplant. So Dr. McGrath actually did get a hair transplant. What's funny is, and most people don't realize this, is that Dr. McGrath, I've seen pictures of him when he was very young, and he was like completely bald back then. Yeah. So actually, in the past videos that you've seen of him, all of that hair on the top of his head that was there was transplanted. He would have been totally bald, like horseshoe bald, if it wasn't for the hair transplants. But Dr. McGrath recently went and had another hair transplant and did some really special things that we're going to talk about. He's going to tell you about that are brand new, and now his hair looks better than, like, way better than ever. I mean, honestly, like, Dr. McGrath's hair looks, as you guys can see in the video. And do you want to show them?
Sure.
Yeah. It just,
I'm super happy.
It looks amazing.
I mean, if my hair stays like this, I'll be happy forever. You know, we've kidded about this in the past when David and I have done some videos that there have been a couple of comments like, well, I don't know, that doctor looks like he might be a little bald, and why doesn't he get transplant?
Yeah.
What you guys don't know is that I started going bald in my late 20s, early 30s. And had I done nothing, he's right, I would be completely horseshoe bald. What you don't know is that I've had 3 strip procedures done by my mentor, one of the greatest surgeons I think on the planet, Dr. Craig Ziering. Wonderful surgeon. You guys can never go wrong. If you're in California, LA, Hollywood, give Dr. Ziering a call because he's the one that trained me, and I think he's one of the finest surgeons on the planet. But he had done 3 separate strip excisions on me. And, you know, for the most part, that gave me pretty decent coverage. Occasionally, you know, if I dyed my hair, I would have to maybe use a little bit of powder to cover up because when you got darker hair and lighter skin. But now that I've let it go gray, it's a little different story. I recently went, this is back in May, for my last hair transplant because what I wanted to do was to try to lower my hairline and get a little bit more density. And so I went to a different surgeon in Beverly Hills, not because I don't love Dr. Ziering as I do, but this surgeon that I went to is also a good friend of mine, and his practice revolves only around doing follicular unit extraction, or FUE. As I've told you in other videos, I don't have a horse in this race in terms of choosing one over another. It's really very patient specific.
Because you do both FUE and FUT.
I do both FUE
yourself.
and FUT. Mm-hmm. For me, the reason I chose FUE is because I had 3 strip excisions, and I would say really I had little to no scarring at all, even from the strip excision. So, but because I'd had 3, I mean, my scalp was a little bit tight. Mm-hmm. So it really wouldn't have been a good idea for me to try to go have a 4th strip excision because
could potentially lead to more scarring.
Yeah, and I didn't want to create scarring, and so I visited with my friend Dr. Baubac, and he assessed my hair and he said, you know what, Dan, I can easily get another 2,000 grafts out of that. And I said, really? I was pretty shocked. I said, great. So we went ahead and we planned the surgery, and he worked on my hairline, and I'm very, very happy with it. I think he did an exceptional job.
And how many months are you into it right now?
So this is right about 5 months, and so I still have more growth to go.
Yeah.
But I'm pretty happy with it. But the whole thing that we're both leading up to here is that we have a little secret, and we've talked about this in some other videos. But you know, I still had a lot of thinning in the mid scalp and in the crown. And
so, I mean, before we get into our secret, let's just talk about, so you had those 3 strip, procedures. What would be the reason that you didn't really have like full coverage because of those 3 strip procedures? Was it, my guess anyway would be the fact that you had those when you were much younger, so the DHT is still attacking transplanted hair as well. It's still going to make it a little finer and thinner over the course of years and years and years. When you have that horseshoe bald kind of area, it's hard to get enough hair to cover your whole head. People don't realize the science of that.
Yeah, and you have to understand that, in general, the statement is hair loss is progressive, and we know that. Well, in my case, over the past 10 years, you guys don't know my personal history, but I have 3 little boys. I have a 10-year-old, a 9-year-old, and a 7-year-old. And so what happened with me was I stopped using finasteride for a period of time. That was while we were trying to get pregnant. And to me, I didn't really see that I had any real change in my hair. It wasn't perceptible to me. It seemed like my hair stayed pretty strong. And so I figured, all right, well maybe I'm past that point because everything is transplanted. But I think over time it started to show up that there was a little bit of thinning. So after I had my last son, and this is about 2 years ago, I started getting back on the finasteride. We use a finasteride minoxidil combination, and I got my hair, at least the donor, much stronger, but I still had a fair bit of thinning in the crown and the mid-scalp. So I would just use different products to cover it up. I was more concerned about my hairline. So what I did is I went to my good friend and colleague, and I asked him if he would do me a favor and also utilize a product that I've been using in my practice, a new revolutionary product called Exosomes. And I've been using it in a testing mode in my practice for about 4 months prior to that, and I've been seeing some pretty remarkable results. So I asked him if he would be willing to inject my mid-scalp and my crown with the Exosomes, and I had to explain to him how to do it.
This is where you were not getting any hair
Correct.
Hair transplanted
Right.
to.
I only had the very front 2 finger widths of my hair transplanted here, so my hairline here, this is all transplanted, and there's still more density yet to come, which I'm really excited about.
Yeah, it looks awesome.
As all of us would be. Even the hair transplant surgeons love to have more hair. Trust me, guys. They say you can never have too much hair or too much money. That's the old saying. But in my case, it's you never have too much hair. So I explained to Dr. Baubac how to use the Exosomes, how to inject them. The company shipped him some product, and he injected it into my scalp, my mid-scalp and my crown. That's when things really, really got interesting, and David will show you my before and after photo, because what the Exosomes...
This is after just 30 days,
30
right?
days.
Which is like insane for new
What
hair growth.
happened was practically unbelievable, because what it did is exactly what it's supposed to do, and we'll talk about the science later. It reset all of my stem cells in the back and mid part of my scalp, and my hair literally regrew through the mid portion and the crown of my scalp. I would say I got at least 80 to 90% of my hair back, and it grew out really within the first 3 months, which is inexplicable. That's why I knew the Exosomes were what it was that was causing the big difference. So now I had pretty uniform hair, pretty nice density. I mean, if I wanted to use a little bit of powder or a little bit of Dermatch or something for a special occasion, I could make my hair look like Pierce Brosnan. I mean, I could make it look any way I want. But the point was, I gained a tremendous amount of density in an area that I didn't have transplanted. And that's when I knew the Exosomes were really the key. And we have seen beyond unbelievable results with our own patients
So
too.
just quickly, besides the fact that I want you to shoot me full of exosomes, what is the difference in that and like the A-cell PRP, which I know is another injectable like stem cell type thing? And we're gonna, by the way, we're gonna have a whole other video. Make sure you check that out. It'll be titled something like, the
science of exosomes.
The science of exosomes and hair loss. You'll see it. It'll be right next to this one, where we're going to talk more in detail about that and how it's different than ASL PRP. But really briefly, how is that different, or how are you? Because I know you also do ASL PRP injections.
And
as well.
I've been doing injectable procedures for going on 6-7 years, utilizing PRP combined with ACell. And one of the things that made that a little bit cumbersome is that a lot of people were using that and using my protocol or maybe a protocol of their own, and a lot of people were seeing very nice results. Usually it would come on between 4 and 6 months, but they were getting nice results. What we found was a bit of an issue with that, and a lot of surgeons would agree, is some people were saying, well, I don't think the A-cell is that important. Some people were saying, well, I don't think the PRP helps that much. Some people were saying, well, I don't really need to microneedle my patients. And so there was a lot of variation in how we were applying this. And so that's fine. I mean, I knew what I was doing was working well for my patients, and so I stuck to my protocol. And I still think it's a good protocol, and I think it works.
Are you seeing like a significant difference? Like I know that time-wise you're seeing a total difference, right? You're talking about 30 days you're starting to see results versus 4 to 6 months. But is it just like volume-wise like a huge difference as well, or?
We did a case, which David alluded to, on a totally bald guy.
Yeah.
And I put just one vial of this in, and he started sprouting new hair in the middle of his head.
So is that something where you feel like if you'd done the same ASL-PRP on that patient, given how bald he was, it just wouldn't have been the same result?
I think it would have been like spitting in the wind.
Really?
In fact, ethically, I would not have even recommended it, because what I had found that the ASL-PRP tended to work best was in patients that had a fair bit of hair, but it was all thinning.
More the
but
diffused.
Guys that were completely bald, I mean, a class 7, I would never have even done that. That would have been unethical.
Yeah, total waste of money.
And the reason I trialed it on this individual was specifically, and I discussed it with him in detail. I said, I don't know if this is going to work. I have no idea. But I'd like to try if you'd be willing. And the guy he's a very nice man. He said, what the heck, let's give it a try.
Yeah.
And I even told him, I said, listen, because the product itself, it's not cheap. It's a fairly expensive product.
Yeah.
But I told him, listen.
Even for you to purchase it.
Yeah, it's very expensive. But I said to the guy, listen, if nothing happens, if we get absolutely nothing, we fall flat on our face, I'll refund you the money and I'll eat it, because I didn't want the guy to feel, because for him it might have been a significant amount of money.
Yeah.
I just wanted him to feel that I wasn't trying to make money off him. We were really just doing this from the standpoint of, can we have a before and after that shows a real effect? And it did. It did have a real effect. So now, with that particular patient, trust me, I'm bringing him back, and he's going to get an unadulterated, pure exosome injection throughout the entirety of his scalp, and we're going to see how far we can go with this.
Yeah.
But the exciting news is, guess
We're
what, guys? I got a nice full head of hair now, and I'm pretty happy. So David loves this kind of stuff. It's new, it's exciting, it's cutting edge. I promise you, if you ask any of your dermatologist friends or doctors, they're not even going to know what an exosome is. But I'm going to make a prediction here and now, and this might be pretty brass, but I'm going to make a prediction that when we get this product in the hands of people that know how to use it, I think this could be just as big, if not bigger, than Botox, because it does work, and I'm showing that it works, and I think it's very exciting. So I think the question is, how many different applications can we use it? Can we use it maybe with patients that have scarring alopecias, or alopecia areata, or something where they've lost a lot of their hair? And it's just exciting because it's effective, it does have teeth, and there's a lot more to come on it, so stay tuned.